Yeah, very good afternoon, everyone. Myself, Dr. M. Srujan Kumar. Yeah, today's topic is absorbable gelatin sponge. Okay, we'll go on to the topic directly. Actually, this topic is under the surgical dressings. It comes under your surgical dressings. Okay, let's go on to the topic. Yeah, coming to the description of absorbable gelatin sponges. This absorbable gelatin sponge, the brand name is Gel Foam. Okay, it is available in the market under the brand name called as Gelatin Gel Foam. And this absorbable gelatin sponge has been included in USP Pharmacopoeia. Okay, that's the reason the name has been given as absorbable gelatin sponge USP. When you say absorbable gelatin sponge USP, that means that this particular surgical dressing has been included in the US Pharmacopoeia. Okay, so whenever you come across any dosage form on that particular dosage form, if it contains something called as BP, USP, EP, or such type of abbreviations, if you come across, it means that the pharmacopoeia is present in the so and so country. Okay, for this particular type of dosage form, there is a pharmacopoeia already established in their own country's pharmacopoeia. Okay, sometimes you may come across some dosage form like it will be written like paracetamol tablets IP, paracetamol tablets USP, paracetamol tablets BP. What does it mean? That means that there is a special pharmacopoeia for this medication and it has been included in so and so country pharmacopoeia. Okay, so what do you mean by this? Gel foam. Gel foam is a sterile compressed sponge, is a medical device. It is called as a medical device intended for application to bleeding surfaces in cases of hemostatic. A person suffering from hemostasis, in that particular condition, you can apply this gel foam. So a person suffering from hemostasis, what do you mean by hemostasis? It is a condition where there will be blood loss. Okay, there will be increased blood loss. In that condition, in order to prevent and in order to stop the blood loss, you will be applying this gel foam onto the surface of the wound. Okay, this is about your gel foam. What do you mean by gel foam? So gel foam is nothing but it's an absorbable gelatin sponge. Okay, it is also called a sterile compression sponge. It is a medical device intended for application to bleeding surfaces as a hemostatic agent. Okay, as a hemostatic agent, it is used in the treatment of hemostasis. Okay, when you say hemostasis is nothing but overbleeding from the wound is called as hemostasis. A situation where you come across that there is more amount of blood loss from the body. In that particular condition, you can apply this gel foam onto the affected area. Okay. So what are the characteristics of this gel foam? It is a water insoluble. Okay. The base solubility of gel foam is water insoluble, off-white, non-elastic, porous, pliable. When you say pliable, pliable is nothing but flexible. Okay, pliable is nothing but flexible form. Okay, product prepared from where this particular gel foam is prepared. It is prepared from three ingredients: purified porcine skin, purified porcine skin, followed by gelatin USP granules and water for injection USP. Water for injection USP. Okay, what is this gel form? What are the characteristics of gel form? The first characteristic, it is water insoluble. The nature, the color of the gel form is off white. Okay, the nature is non-elastic nature, and it is also having a porous nature. At the same time, it is flexible in nature, that is nothing but pliable. Okay, from where it is prepared? It is prepared from purified porcine skin. Porcine is nothing but pig skin, pig skin. Okay, purified porcine skin, followed by the other ingredient called a gelatin USP granules, followed by USP water for injection. Do you remember while discussing about your water? Okay, definitely I said that while during your any pharmaceutical dosage form, you need to use USP type of water. So here USP type of water for injections. Such type of water should be used for the preparation of gel foam. Why USP water for injection? The reason is that because as you are applying this particular gel foam to an affected area where it will come in contact with your blood circulation. So anything that comes in contact with your blood circulation should be sterile enough and should be prepared in an aseptic conditions. It should be sterile enough. It should be prepared in an aseptic conditions. So it may be cut without fraying. Okay. Now we are talking about how to cut this gel foam. So when you say gel foam will be available in sheets, ma. Okay, small sheets or large sheets. So can you see here the different shapes of gel foams available? Okay, so the cubical gel foams are there. Sometimes you may get gel foams in a packet. That gel foam is in a sheet form. So you need to cut it into small pieces based upon the size of the wound, based upon the size of the wound. Okay, so when you cut that wound, you need to cut in such a way that it should not leave any sort of worn edges. It should not leave any sort of worn edges or torn edges. So imperfect edges it should not leave. It should be exactly. Sometimes if you want to cut something, you see when you started cutting it, sometimes you may not cut the shape perfectly. Ultimately you can feel some lint of fibers coming out at the edges of your sheets. Okay, that particular edges should not be there with your absorbable gelatin sponge. That imperfect worn edges is nothing but called as fraying. Imperfect worn edges are nothing but fraying. That fraying should not be associated while cutting the absorbable gelatin sponges. Okay, and is able to absorb and hold within its interstices, okay, many times its weight of blood and other fluid. And the nature, that absorbable gelatin sponge should hold some nature. That nature should be in such a way that whenever this particular absorbable gelatin sponge applied onto the affected area, okay, and it has to withdraw your blood and other fluids from your uh, wound. Okay, it has to absorb in such a way that it has to absorb many times its weight, ma. Okay, it is not like small amount of the, so small amount of blood or fluid it is absorbed, and the thing now it is not in a position to absorb more amount of blood and fluid. Now it is not called as absorbable gelatin sponge. Just have an imaginary kind of a thing, ma. You take some small cotton ball and apply onto the affected area. What is your observation? So to some extent it will absorb the blood, and after that entire that cotton ball will get wetted. Okay, and you need to throw it out. But in the case of absorbable gelatin sponge, it should absorb and it should expand. Okay, it has to intake more amount of blood and fluid. This is how it has to hold its characteristic. Okay, so this is about your description about absorbable gelatin sponge. Okay, coming to the actions of absorbable gelatin sponge. Actions of absorbable gelatin sponge. So this gel form sterile compressed sponge has hemostatic properties, as I said before. Okay, what do you mean by hemostatic? It prevent blood loss, and it prevent at the same time it will stop the blood loss. While its mode of action is not fully understood. Okay, till now they are into clinical trials to understand what is its exact mode of action, but at this point it has been not fully understood. Its effect appears to be more physical than the result of altering the blood clotting mechanism. So its effect can be seen physically. Okay, so internally you cannot say what is happening exactly, what is the mode of action, but physically you can say that just it is altering the blood clotting mechanism. Okay, just it is altering the blood clotting mechanism. This is what you can say. So when not used in excess amounts, okay, gel foam is absorbed completely with little tissue reaction. When you don't use excess amount of gel foam to that particular affected area, when you don't know that how much gel foam to be applied to the affected area, what happens, that gel foam will completely absorb to the wound, okay, and it causes some little amount of tissue reaction. Okay, so it gets added to the wound and it causes some tissue reaction. Okay, so it is very important to check with the wound size and wound area. At the same time, you need to check the severity of the wound. That is very important, the depth of the wound. So accordingly, you need to cut your absorbable gelatin sponge. It is not like you need to be trained sufficiently enough in that particular area. Okay, when you don't have idea about surgical dressings, don't use it better. Okay, it is not like you cut something and you apply onto the affected area. So it should be adequate enough to absorb the fluid. If it is not adequate enough, your gel foam will get absorbed to the wound and it will cause tissue reaction. Okay, this absorption is dependent on several factors, including the amount used, degree of saturation with blood or other fluids, and the site of use. As I have discussed the points, depth of the wound, severity of the wound, all these things. Now the discussion is here. This absorption is dependent on, when you say it is absorbed completely or it is absorbed partially. So these particular things will depend upon what? It depends upon the amount used, degree of saturation with the blood or other fluids, and the site of use. Okay, so when you consider these three things, accordingly you need to use your absorbable gelatin sponge. When placed in soft tissues, so here we are talking about one point called as, when this absorbable gelatin sponge, when it is applied to soft tissues, gel foam is usually absorbed completely within 4 to 6 weeks. When you are applying to soft tissues, this gel foam is, how efficient it is, you just check. It is completely absorbed within 4 to 6 weeks. It will take 4 to 6 weeks to get your gel foam completely absorbed to the soft tissues. How efficient your gel foam is, just notice here. Without inducing excessive scar tissues, it will not cause any sort of scar tissues. Okay, it will not cause any sort of scars onto that affected area. When applied to bleeding nasal, rectal or vaginal mucosa, it liquefies within 2 to 5 days. So the same gel foam, when you are applied to a different areas like nasal bleeding, rectal bleeding or vaginal mucosa bleeding, so this particular gel foam, it will liquefy within 2 to 5 days. So it will just liquefy and it will just move off within 2 to 5 days. So here two sites we are going to come across. One side is soft tissue, the other one is bleeding, nasal bleeding, rectal and vaginal tissues. So two types of tissues are in soft tissue. It will take about 4 to 6 weeks, but in the case of, in the latter case, it will take about only 2 to 5 days. This is how your gel foam behavior will change according to the site of use. Okay, so that's all. Can you see some images here? The first image will talks about your gel foam in the form of sheet. Okay, gel foam absorbable gelatin sponge, it is in the form of a sheet. And the second, you can see the image, it is in the form of a powder, gel powder. Okay, just that powder you need to roll it and you need to apply onto the affected area. And third and fourth image, it is a different sides. You can see the buccal cavity, right? After some surgical incision into the buccal cavity, on what we can say, tooth decay or some kind of problems where you are going to also.
Excuse me, sir. Hello, sir.
Yama, is there is a disturbance?
Yes, sir. Someone muted your call.
Oh, yeah. So where I stop? So I'm talking about the images.
Yes, sir. Yes.
Okay. So I repeat the same. So when placed in soft tissues, gel foam is usually absorbed completely within 4 to 6 weeks without inducing excessive scar tissues. Okay. So here we are talking about a site where your gel foam can be applied. The first site, as an example, you are going to talk about soft tissues. When your gel foam applied to soft tissues, it will, the absorption time will vary from 4 to 6 weeks. The same gel foam, when it is applied to your nasal area, rectal or vaginal area, it will liquefies within 2 to 5 days. This is how your gel foam behavior will change according to the site. Okay, site of your body. Okay, so here you have some 4 images. The first image will talk about your absorbable gelatin sponge. It is present in the form of sheet. The second image will talk about the gel foam in the form of gel, in the form of powder. Okay, and the third image and fourth image, it is in the case of your dental procedures and all, you will be using this absorbable gelatin sponge in order to absorb the excess fluids, or in order to prevent the blood loss, you will be using the gel foam. Okay, so next, moving on to the next slide. So indications, next is indications. Next is indications. So indications are nothing but in which conditions you are going to use your gel foam. Okay, nothing but uses of your gel foam. So gel foam is indicated in a condition called as hemostasis, as I discussed earlier. Gel foam sterile compressed sponge used dry or saturated. So this gel foam sterile compressed sponge can be used in two ways. One, it can be used as such in dry condition immediately after taking from the packet, or it can be used as a saturated condition, so by dipping in sterile sodium chloride solution. Okay, one, it can be used as dry, the other it can be used as wet. When you say wet, it is not like you dip it into water. Okay, you need to saturate your absorbable gelatin sponge with sterile sodium chloride solution. It is indicated in surgical procedures as a hemostatic device. Hemostatic device. So wet form will be indicated in surgical procedures. Okay. In dry form, it will be indicating in normal cuts and wounds. So in surgical procedures, in what way this particular absorbable gelatin sponges will help? So to control of capillary, venous and arteriolar bleeding by pressure. Okay, by applying pressure onto your capillaries, venous and arteries, okay, you can control the bleeding. Okay, at the same time, when surgical procedures have been associated with sutures and ligages, at that particular point also you can apply your absorbable gelatin sponge in wet condition. And other conventional procedures is either ineffective or impractical. So not only the things that have been mentioned where your wet absorbable gelatin sponge should be used in when it come across your capillary veins and venous and arteries, it is not only that during your sutures and ligatures, so it can be applied wherever it can be necessary. Okay, although not necessary, gel foam can be used either with or without thrombin to obtain hemostasis. It's an important point, ma. Okay, so normal cuts and wounds and normal surgical procedures, it is not like always you adopt thrombin. Okay, what do you mean by thrombin here? Thrombin is nothing but a coagulative substance, ma. Okay, when is there is increased bleeding, when there is no way to control, sometimes this gel foam will be used in combination with thrombin. Gel foam will be used in combination with thrombin. Thrombin is nothing but a coagulative substance. Okay, it helps in coagulation of the area. Okay, when it helps in coagulation of the blood, ultimately it results in clotting of the blood, thereby it will protect the human being. Okay, so normally gel foam can be used alone, sometimes it may used in combination with the thrombin also. This is an important point. Next, direction for use. Direction for use. So what are the direction? How to use? So always I used to say something like, any dosage form you come across, patient education is mandatory. In patient education, it will be, you will be gaining importance about how to use the dosage form. See, for tablets and capsules, no patient education is required. That is okay for us. But at what time you need to take this tablet, patient education is mandatory. See, anti-ulcer drug should be taken before breakfast. That is important. That is nothing but one kind of patient education. Coming to the dosage form, so always we need to take a very common example about your suppository. So some people might not be knowing what do you mean by suppository. Suppository look like a tablet. A layman will not understand. Ultimately, what he will do, just he will take some glass of water, and there is a chance. Okay, I'm not saying that all the people will do the same. There is a chance that they may take along with the water through oral administration. So here for gel foam also, it is not like a normal one. So direction of use is very important. So here the first direction of use is, sterile technique should always be used to remove gel foam, sterile compressed sponge from its packaging. So here it's an important instruction. It is not like you tear with your bare hands this gel foam packet. So here sterile technique should be used. That means sterilized forceps. Okay, you need to have sterile gloves onto your hand. So such type of care should be taken while opening the gel foam sterile compress sponge from a packaging. Okay, so cut to the desired size. Next step, first you need to ensure the sterile technique should be maintained while opening the packet. Okay, next step, cut to the desired size. A piece of gel foam, either dry or saturated with sterile isotonic sodium hydrochloride solution, can be applied with pressure directly to the bleeding site. So the next step, what you need to do, you need to cut to the desired size. When we say cut to the desired size, that particular absorbable gelatin sponge should be free from what? Fraying. When you say fraying, what do you mean by fraying? worn edges ma. Worn edges should not be present. Clear? So it should be free from fraying. Okay, after that you need to cut the piece of gel foam. After cutting the piece of gel foam, either this gel foam can be used directly, okay, sorry, in dry condition, okay, as such, or you can also use it with the sterile isotonic sodium chloride solution. Just you need to saturate your, saturation is nothing but dipping your gel foam into a sterile isotonic sodium chloride solution. Why sterile isotonic sodium chloride solution? Because this gel foam will be coming in contact with your blood. When it comes in contact with your blood, ultimately it should maintain what? Isotonicity. What do you mean by isotonicity? Two solutions having same osmotic pressure is called as isotonicity. When it can maintain the same isotonicity, ultimately it will not irritate your uh, wound area. Okay, and after saturating with an sodium chloride solution, you need to just apply that gel foam onto the bleeding side, okay, with some slight pressure onto that, with some slight pressure onto that. When applied dry, a single piece of gel foam should be manually applied to the bleeding side and held in place with moderate pressure until hemostasis results. Okay, so as wet, you need to saturate with a sodium chloride solution, and that solution should be adjusted to isotonicity. This is first thing. Okay, so when you adopt your sodium chloride solution, ultimately that solution will maintain isotonicity. Okay, that is for sure. When you are applying the same in dry form, so that dry form should be cut to a desired size, and that single piece of gel foam should be affected to the applied to the bleeding side, and it has to be held with a moderate pressure until hemostasis results. Hemostasis nothing but until the bleeding stops. Okay. When used with sterile saline, gel foam should be first immersed in the solution and then withdrawn, squeezed between gloved fingers to expel air bubbles, and then replaced in saline until needed. So here it's something very important that if you want to saturate your gel foam with a sterile solution, so what you need to do, you need to take the gel foam, you need to dip it into the sterile solution. After dipping into the sterile solution, you need to just squeeze the gel foam. What capability this gel foam holds, it will absorb the water. After absorbing the water, just you need to squeeze the gel foam in your hands, okay, between your two fingers. Okay, when you squeeze it, ultimately it will whatever air bubbles, okay, because there is no water present already clearly opening from the packet. Okay, when you dip it, ultimately some air cavities will be formed inside your gel foam. You need to ensure that to expel your gel foam from air bubbles, it should be free from the air bubbles. Okay, till it is free from the air bubbles. After that, you just retain this gel foam inside the saline solution prior to the use. Okay, till the what we can say, till you use this gel foam, to that point you just place it in the saline solution. First you need to ensure what? To expel the air bubbles from your gel foam. That is very important. And gel foam, if used wet, it may be blotted to dampness on gaze before application to the bleeding side. So when the same gel foam, when it is used in wet, see, when gel foam is used as dry, there are no much precautions, ma. Just ensure that sterile technique is maintained to remove it from the packet, cut it into the desired size, apply onto the bleeding side with moderate pressure onto that. That is job done with your dry form. When it comes to the wet form, here you need to take an isotonic solution. Inside that you need to dip it. When you dip it, you need to squeeze it to check the whether the gel foam is devoid of air bubbles. Okay, just you need to remove all the air bubbles. Then you need to ensure that okay, your gel foam is ready. So after gel foam is ready, now you need to blot your gel foam to the dampness. Just you need to place one gauge before applying to the bleeding site. Just you need to place a gauge. I think everyone knows about the gauge, surgical gauge. Onto that you need to just place your gel foam, okay, to remove the dampness. Okay, it should be held in place with moderate pressure. Just you need to place it over the gauge, and just you need to held onto the bleeding side. Just you need to position onto the bleeding side with the moderate pressure using a pledget of cotton or small gauge sponge until hemostasis is results. So pledget of cotton is nothing but small wadding of cotton should be applied behind to apply some moderate pressure onto your gel foam. Okay, Removal of the pledget or gauze is made easier by wetting it with few drops of sterile solution. So when you ensure that entire bleeding has been stopped, that is nothing but hemostasis has been stopped. So what you need to do, you need to remove the pledget or gauze. Okay. So how to remove that pledget or gauze? Just you need to wet it with few drops of sterile saline to prevent pulling of the gel foam. Why you will apply the gel foam onto the affected area? The reason is, so it has to remain intact to the affected area so that it absorbs the bleeding, thereby it will stop the hemostasis. This is the purpose. So after applying, when you start removing that gauze or pledget from the affected area, so when you apply more pressure, what will happen? Your gel foam also come along with your pledget or gauze. In order to avoid that, you need to wet the pledget or gauze with the help of sterile water, so that slowly you need to remove your gauze so that your gel foam will remain intact with your affected area. Okay. So which by then should enclose a firm clot. So when you remove that, that gel foam will get absorbed to that affected area, thereby what it will do, just it will enclose a firm clot. That clotting has been done there. Okay, that is nothing but it will prevent blood. So what is the mechanism involved here? It stops the blood, thereby forming a clot over the affected area. This is how it works, your gel foam. So use of suction applied over the pledget of cotton or gauze to draw blood into the gel foam is unnecessary, as gel foam will draw up sufficient blood by capillary action. Okay, so it is not like here it is very much important step. It is not like you, in order to absorb the blood from the affected area, you are not allowed to keep any sort of suction over there. When you apply the suction, this gel foam have a capability to withdraw the blood from the capillary. Okay, withdraw the blood from the affected area through a action called as capillary. Always gel foam is ready to absorb whatever that is present inside. When you apply suction behind that gel foam, what will happen? Whatever blood, leave about the clotting factor, whatever blood that is present, it will just sucked outside. Okay, that should not be done. Okay, the first application of gel foam will usually control bleeding. Okay, in the first instance, what gel foam will do, it will just control the bleeding. But if not, additional applications may be made. For additional applications, fresh pieces should be used and prepared as previously described. For example, a particular person met with an accident, okay, and he had got a wound over there. Now I want to just stop the bleeding. Okay, as a first application, when I started applying a small piece according to the desired size of the wound, when I started applying it, so after 5 to 10 minutes, just I observed that that particular gelatin sponge has been completely absorbed, and still the bleeding is not stopping. So here what we need to do, here you need to cut more amount of pieces of your gelatin sponge in the same procedure whatever we have depicted till now. Then you need to apply that pieces also onto the affected area in order to stop the bleeding. Okay, these are the directions of use only the minimum amount of gel foam. Again, it is an important thing. You have a very big piece of gel foam, it is not like you apply the entire piece onto the affected area. Just you use the minimum amount of gel foam, whichever appropriate and necessary for the corresponding to the size of the wound. Cut to appropriate size necessary to produce hemostasis. Okay, the gel foam may be left in place at the bleeding sites when necessary. Sometimes the gel foam, even though it has been absorbed, it has to be left in space on the left in place on the bleeding site. Okay, when necessary. When necessary in the sense, now see, he had met with an accident here. Just I have applied this gel foam onto the affected area till he moves to the hospital, till he is about to undergo the surgery. Till that point, it has to be left in the place. Okay, since gel foam causes little more cellular reaction than does the blood clot, the wound may be closed over it. Gel foam may be left in place when applied to mucosal surface until it liquefies. So in the case of normal wounds and all here and there, it is okay to leave the gel foam, because nothing will happen here. The cellular reaction will take place, and what it will cause, it will induce a blood clot over there, and slowly the wound get closed over. Okay, but when it is applied in the same this gel foam into the mucosal surfaces, no need to remove that, because in mucosal surface it will get liquefied. Okay, as already discussed, gel foam applied into nasal cavity or your vaginal or your rectal cavities and all, in that particular cavities, your in that particular cavities are rich of what? Mucosa. So when this gel foam applied to the mucosal surface, no need to remove that. It will get absorbed slowly. It will get liquefied. Okay. For use with thrombone, consult the thrombone insert for complete prescribing information and proper sample preparation. So in order to use the same gel foam, in the case of, see, even though when you apply this gel foam you are not able to stop the bleeding, ultimately you need to shift on to an alternative called as thrombin. So that thrombin kind of marketed formulations are thrombin inserts. They are called as thrombin inserts. Okay. So in order to go have an understanding on this thrombin also, just you can check with your online internet literature and gain some idea on that. But as of now we are dealing only with absorbable gelatin sponge. We are only confined to gel foam. Okay. Yeah. Next, contraindications. Next heading is contraindications. So, gel foam sterile compressed sponges should not be used in closure of skin incisions, but because it may interfere with the healing of skin edges. Here contraindications means in which conditions where your gel foam is contraindicated. That means not to use. Okay. So the condition where you have something called as closure of skin incisions. Okay. You have made an incision onto the skin and you want to close that incision. To close that incision, what you need to use? You need to go for sutures and ligatures. But in order to close that incision, if you apply this gel foam onto the affected area, okay, so leave about the clotting factor, healing and all. Okay. So it will interfere with your healing of your skin edges. The skin edges will be there, right? So when you made an incision onto the skin, okay, not only the depth of the incision, you can see skin edges. So that skin edges will be interfered with your gel foam. Okay. So leave about the clotting factor. It will definitely interfere with your healing of your skin. It will take more time. So here it is better to go for sutures and ligatures rather than gel foam. So you need to know in which condition gel foam should be used and in which condition gel foam should not be used. This is due to mechanical interposition of gelatin and is not secondary to intrinsic interference with wound healing. So why it will interfere with the healing of skin edges, do you because of the presence of your gelatin. So what gelatin will do, gelatin will go and have an interposition onto the edges of your skin. Okay. So thereby it will cause interference with the wound healing. Next, gel foam should not be placed in intravascular compartments because of the risk of embolization. Okay. Next, contraindication is gel foam should not be used in intravascular compartments. Okay, you need to be very peculiar with this. So gel foam should not be used in intravascular compartments. So our body has different compartments. Do you know that? Intravascular compartments, extravascular compartments. Okay, so gel foam is contraindicated in intravascular compartment. Why it is contraindicated in intravascular compartment? Because of the risk of embolization. What do you mean by embolization? Embolization is nothing but your blockade of your blood vessel. Embolization is nothing but blockade of your blood vessel. It might be due to the fatty substance. It might be due to the any substance. When you say any substance, gel foam will result in your blockade of your blood vessel. Okay. So next contraindication is do not use gel foam sterile compressed sponge in patients with known allergies to porcine skin, porcine collagen. Okay. Again, it's an important point. There are some people who are allergic to porcine collagen. Okay. But here your gel foam has been extracted. What is the source of your gel foam? Porcine collagen followed by your gelatin followed by your water for injection, USP. Okay. So people who are allergic to porcine collagen, okay, for such type of people your gel foam is contraindicated. Clear? These are the contraindications of your gel foam. Next, warning. Warning. Next subheading is warning. So gel foam sterile compressed sponge is not intended as a substitute for meticulous surgical technique. Okay. So never you should assume that gel foam sterile compressed sponge is a substitute for your surgical technique. Surgical technique is different. Gel foam is different. And the proper applications of ligatures or other conventional procedures for hemostasis. always for hemostasis there are some surgical techniques are there, surgical procedures are there to stop. Okay, it is for minor wounds and cuts you can use your gel foam sterile compressed sponge. It is not at all a substitute for any sort of surgical techniques or your ligages. For example, a person met with an accident and he had hurted himself so badly, you need to go for ligatures, sutures and ligatures. So in such particular conditions of sutures and ligatures, or a leave about sutures and ligatures, just apply the gel foam, that would be sufficient. It is not a substitute. Okay, the surgical technique should go as such and your gel foam roll should go in a different way. Okay, gel foam is only meant to absorb your blood and fluids and in order to stop your bleeding. Okay, to a little extent, not to a major extent. Okay, next, gel foam is supplied as a sterile product and cannot be re-sterilized. One more important thing. So already the gel foam has been supplied as a sterile product. Again, you need not to go for re-sterilization of your gel foam. Some people are there, extra smartness, they'll go for re-sterilization of your gel foam. That should not be done. Okay. Unused opened envelopes of gel foam should be discarded. Okay, when you don't use and then the envelope is open for prolonged period of time, that gel foam should be discarded. Warning again, to prevent contamination, employ aseptic procedure in opening envelope and withdrawing gel foam. One more warning here, it is that, so in order to prevent contamination, always ensure that a sterile technique should be habituated. Okay, in order to open your envelope, sterile technique as well as aseptic techniques, aseptic procedures to open an envelope and to withdraw the gel foam from the packet. Already we have been discussed about this. If the envelope is torn or punctured, the contained gel foam should not be used. It is not only with the gel foam, okay, it is with any dosage form. It is an important precaution, if any leakage you have been observed, if the envelope is not torn or your product has been punctured, or if your labeling is not proper on the product, if you feel that something has been crushed, so you should not use the dosage form. So here it is very important for your gel form, because gel form will come as a sterilized form. Okay, when you observe something torn or punctured, ultimately whatever sterility that is present inside will be exposed to the outside moisture, so you should not use that. The use of gel foam is not recommended in the presence of infection. Whenever a particular person is suffering from any sort of infections, in that particular infection conditions, gel foam should not be used. The packing or wadding of gel foam, particularly within bony cavity, should be avoided. So you should not pack gel foam in case of your bony cavity. So for example, see, a patient has been there, so that patient he had undergone a surgery, that to a bone surgery. So in that bone surgery, when bone surgery has been done, so in between one bone and another bone, you will always expect growth in the bone. Okay, so in between that, you are not allowed to pack that particular space with the gel foam. When you pack with the gel foam, what will happen, it will swell to original size, may interfere with normal function. So uh, I think till now you have just imagine what gel foam is. When gel foam is placed under water, it expands. So when you place this particular gel foam in between two bones, what will happen, it will expand to its original size. So when it expands to its original size, there will be no room or space for your bone to grow. So it definitely it will interfere with the normal functions, possibly result in compression necrosis of your surrounding tissue, because your bone will start pushing your bone has started its growth, and there is no place for the bone or room for the bone to grow. Ultimately what happens, there will be increase in compression. That compression will result in necrosis of the surrounding tissue. So these are the warnings about your gel foam. Next, dosage and administration. Dosage and administration. So sterile technique should always be used in removing the inner envelope containing the gel foam. Sterile sponge from the outer printed sealed envelope. Okay. So this is a discussed one. The minimum amount of gel foam of appropriate dry or wet. So you need to see the directions for use to the bleeding side and held firmly in place until hemostasis is observed. So ultimately, you need to apply some surgical techniques to open the packet of your gel foam. Okay. After opening that particular gel foam from the packet, okay, by applying your surgical technique, you need to cut it into an appropriate size based upon the severity and depth of the wound. Okay, and it might be applied according to the USMA. It might be dry form or wet. When you are applying dry, it has been applied directly onto the bleeding site, formed by putting some moderate pressure onto that. When you are applying wet, ultimately it has to be immersed into a isotonic sodium chloride solution, and it has to be applied onto the bleeding sites till your hemostasis is stopped. Okay, so opened envelopes of unused gel foam should always be discarded. This is very important. Okay, so any open envelopes or any punctured envelopes, any torn envelopes should be discarded. Very important. Storage and handling. Gel foam sterile compressed sponge should be stored at 25 degrees centigrade, 77 Fahrenheit. Exertions permitted to 15 to 30 degree. Exertions permitted to 15 to 30 degrees centigrade, 59 to 86 degree. Okay. So these are the temperature conditions given. It has to be stored at 25, but in by chance, if any temperature fluctuations from here and there, the range is given 15 to 30 degrees. 15 to 30 degrees. Once the package is opened, contents are subject to contamination. When you open the package, immediately the burn contaminants that are present in the atmosphere will start attacking your gel foam. It is recommended that gel foam be used as soon as the package is opened and unused contents discarded. So when you open this particular container, immediately you use the contents of your container, like your gel foam packet, and if there is any unused gel foam which you cannot use instantly, so the remaining should be discarded. It is very important. It is not like today you use half or a milli or micro or some small 1 centimeter. The size of the gel foam is 50 centimeters, but you have used only 1 centimeter. But it is important that you discard the remaining. It is not like you keep it for the next day by putting some tape, plasters, or storing in an airtight container. It will not work. Okay, that's the reason it is says that it is a sterile dosage form. Okay, sterile surgical dressing. Sorry, it's not a dosage form. It's a sterile surgical dressing. This product is pre-packed, sterile, and intended only for single use. It has been packed in such a way that, okay, it has been intended only for single use. Single use means only one use you need to use and you need to throw it away. It is important. Reuse can result in transmission of blood-borne pathogens. So when you reuse this device again, this gel form device, it will result in blood-borne pathogens, including HIV and hepatitis, potentially endangering patients and healthcare providers. It is very important. It is not like you overlook the things and you say that what will happen. Just now I have opened only 1 centimeter. I have utilized. For this also we have to throw the packet. Means you need to worry about your other bloodborne pathogens like HIV and Hep. Which is better? You are discarding 49 centimeters or getting life-threatening diseases like HIV and hepatitis. Okay, so discarding 49 centimeters would be the better option. Okay, so adherence to the principles of aseptic technique when using this product is essential. Adherence means that is nothing but called as patient's adherence towards the dosage form. Patient adherence towards the surgical dressing. That is very important. As it is said that utilize surgical techniques, utilize aseptic techniques means you need to adhere to that particular techniques while using the product. It is very essential. That's all about your today's class. Thank you very much. This is about your absorbable gelatin